For more than a decade, student mental health has been declining in the U.S., but only half of public schools offer mental health assessments or treatment services, and schools are struggling to meet the mounting mental health needs of students. The Uncommon Schools Network of public charter school districts in New Jersey has an enrollment of nearly 8,500 students and is supporting more than 1,100 student case files related to mental health.
In a post-pandemic world, the adolescent mental health crisis is almost unmanageable. Our suicide screenings tripled in the 22-23 school year from the year before for grades 5 through 12, and these students are struggling tremendously.
Since joining Uncommon Schools in 2017, the size of Martinez's team has doubled to 25 school social workers. During her first 2 years, paper documentation was the standard for the social work team.
I was doing monthly audits by paper. By the time I finished 1 month, it was time to start on the next. The work time and task time for this process was not sustainable.
And then the COVID pandemic hit. With the school social workers working remotely, there was no system in place for Martinez to be able to review the team's files or easily produce reporting data. The lack of a streamlined case management system created extra administrative tasks for everyone and made it difficult for the team to communicate to school leaders what their students were experiencing. They needed a collaborative solution that would not only provide an electronic platform for recording counseling notes, but would also allow secure multi-level access and comprehensive reporting. When Martinez heard that ECINS was the only solution of its kind endorsed by the School Social Work Association of America, she booked a demo.
ECINS helped me envision what our potential social work program model could look like by using the student support and case management systems. I could see that this was an affordable system designed specifically for school social workers.
ECINS deploy the case management and referral management modules to the school's social work team, who use the summer to work out user logistics, conduct formal training sessions, and customize the system to work within their established processes.
The system has amazing functionality, and I wanted to be realistic about the scale of it and what we could do with it initially. ECINS implementation team and I agreed that it would be smart to start small and be able to hold the team accountable because of its size.
ECINS team provided guidance and tech support to the team as they familiarized themselves with the system, meeting monthly with Martinez to answer any running questions they had and to respond to potential customization requests.
The ECINS support team is extremely responsive. My team knows how to reach out directly to them if they have any questions, which is especially helpful for less tech-savvy users on the team.
When students arrived back on campus in September, the school social workers were ready. Using ECINS, Martinez and her team had standardized the referral process across all 19 schools, using one streamlined electronic student wellness referral form that allowed them to quickly and uniformly collect information from school personnel across the districts. The new process eliminates verbal and paper requests and ensures that no student slips through the cracks.
In the beginning of the school year, we had close to 2,000 incoming referrals. It was overwhelming, but we were prepared and organized and responding to student mental health and child welfare referrals within 24 hours. Using ECINS definitely improved our process for documentation too. The case management system has enabled us to create an environment where everyone is documenting in the same way, which helps improve our process and standards of care.
Today, the Uncommon Schools School Social Work team is successfully supporting the needs of student mental health while efficiently and effectively managing the workloads and administrative responsibilities of their program.
We've basically created standardized processes for student mental health supports across our network of schools, using ECINS as the vehicle to carry out that program.
And ECINS has made it easy, not only by streamlining the processes and procedures that enable better outcomes for students, but also by providing administrative relief to the school social workers by improving their workflows and everyday tasks.
The level of support ECINS provides makes a world of difference. I get giddy when I realize that a task that might have taken me 14 hours before just takes me 14 minutes on ECINS.
After the first year of ECINS use, the North Star Academy and Camden Prep School districts provided resounding support for the system by extending its use into the next school year and beyond. In addition, they will implement the ECINS Student Engagement Portal later this year to explore the capabilities of the mobile communication app.
The hope and the goal is to implement ECINS as the standard, streamlined platform for student support across the entire Uncommon Schools network.
Learn how ECINS student support and case management system can help your school evolve its mental health program. Visit ecins.com.